Hello, this is Dr. Trace Curry, Medical Director at JourneyLite. Let's get you ready for your gastric balloon procedure. There are currently 2 balloons available, although this can change at any time. The Orbera gastric balloon has been around the longest. It's a saline-filled balloon placed with a scope while the patient is sedated. It has to be removed after 6 months. Spatz is the second and newest balloon approved by the FDA. It's also a saline balloon placed with a scope while the patient is sedated. Unlike the Orbera, the size of the Spatz can be adjusted. Also, it can stay in the stomach for 8 months. Now let's talk a little bit about the risks of gastric balloon. Gastric balloons as a whole are very low-risk procedures. However, there are always some risks anytime you are putting a scope or a device down the esophagus. There is a small risk of perforation or making a hole in the esophagus. This is an extremely serious complication, but it is also extremely rare. Balloon intolerance can happen, which means that the patient has continued vomiting that requires early removal of the balloon. In the case of a Spatz, the balloon can be down adjusted in most cases rather than being removed. Lastly, there is a small risk of leakage of the valve on a balloon, causing it to deflate in the stomach. If this were to happen, it would have to be removed. For the Spatz, a blue dye solution is used so that it would turn your urine a bluish-green color in the case of a leak. For the Orbera, there is no dye used, so it can be more difficult to tell when a leak occurs. Fortunately, leaks are extremely rare with these 2 devices. Let's talk now about medications that will be prescribed for your procedure. If your prescriptions haven't been called in by a week prior, please text us at 513-572-1718 or email us at provider@curryweightloss.com. We recommend, but don't require, that patients start an acid reducer around 2 weeks prior to surgery. This can reduce the chance that there is any inflammation or other issues that could prevent us from implanting the balloon. So we'd like you to start Prilosec, or the generic, which is omeprazole, 40 milligrams daily. If you're already on one of the medications listed on the screen, that's also fine. Get this going about 2 weeks prior to surgery if you can. We also recommend, but don't require, a medication called Emend. The generic name for Emend is aprepitant. Emend is a very powerful anti-nausea medication. Because it's so new, it can be expensive depending on your pharmacy benefits. In addition to checking with your insurance, we also recommend checking the price on the GoodRx app on your phone to see which one is better. If you opt for aprepitant, we will prescribe 2 tablets. One is meant to be taken before your procedure. No matter what anyone else tells you, take it with a sip of water immediately when you pull into the parking lot at JourneyLite Surgery Center. This way it will be absorbed into your system by the time you have your procedure. Save the second tablet, which is to be taken the morning after your procedure. Next, let's talk about GLP-1 receptor agonists, which are injectable medications for either diabetes or weight loss. These include brand names such as Ozempic, Victoza, Trulicity, and Mounjaro. The generic names for these are semaglutide, liraglutide, and tirzepatide. Because these drugs slow gastric emptying, they need to be stopped around 1 week prior to your procedure. Please talk to your prescribing physician before stopping them to see if your other diabetes medications need to be adjusted during this time. The day prior to your procedure, we recommend eating only soft solids and avoiding any meats, as we need to make sure there's no food in the stomach. And just like with most procedures, nothing to eat or drink after midnight. Your procedure will be at JourneyLite Surgery Center in Cincinnati. You will be sedated for the procedure, so you need a responsible adult to drive. Ubers, Lyfts, and taxis are not allowed. The procedure will take about 30 minutes, during which a scope will be guided down your esophagus. As long as the anatomy looks good, the balloon will be inserted and inflated with saline. After the procedure, you'll be in recovery for about an hour. Now let's talk about what to do after your balloon is implanted. After your balloon insertion, nausea and vomiting is completely normal. In some cases, it can be severe, but it usually resolves after a few days. You should have taken your first aprepitant on the day of your procedure, so take the second tablet the morning after. Aprepitant is also called Emend. If for some reason you didn't take the first tablet already, just take one the morning after your procedure and the other one the following day. You will also be prescribed Zofran, or the generic, which is ondansetron. This is a sublingual tablet, which means it should be dissolved under your tongue and not swallowed. We recommend you take one tablet every 6 hours for the first 24 hours, then you can use it as needed afterwards. You will also be prescribed Levsin, or the generic, which is hyoscine. This is also a sublingual tablet, and you can take 1 or 2 every 4 hours as needed for cramping. If you have a Spatz balloon and you're still vomiting 72 hours after your procedure, please get in touch with us, as we may need to down adjust your balloon or remove some saline from it to make it smaller. As far as your diet, for the first 3 days, limit yourself to non-carbonated clear liquids. You can do things like water, Crystal Light, clear broth, and sugar-free popsicles. You can also use our fruit drinks, gelatin, bouillon, and hot drinks. These products are available at all of our office locations and also on the e-store at JourneyLite.com. In the first 3 days, please avoid carbonated beverages, sugary drinks, and acidic beverages like citrus juice, tomato juice, or Hawaiian punch. On day 4, you can progress to the full liquid puree phase, as long as you aren't having any ongoing vomiting issues. If you are, stay on the clear liquid phase and get in touch with your dietitian. When you are ready to progress, you can start to take protein shakes, yogurt, scrambled eggs, oatmeal, and so forth. During this time, please avoid food with chunks or large pieces, sugary desserts like ice cream, and carbonated beverages. As long as you have been tolerating the full liquid puree phase, after day 7, you can advance to soft foods. The goal is a high-protein, low-carb diet with small, frequent meals. If you eat too much, you will likely have GERD issues and/or vomiting, so keep your portion sizes small. As far as exercise goes, avoid anything strenuous for the first week. After a week, as long as you're not having any vomiting issues, get started on some cardio. Ideally something that you can do year-round, like an elliptical or a treadmill. Aim for a minimum of 30 minutes 3 to 4 days a week. We also highly recommend getting an activity tracker like an Apple Watch or a Fitbit, so that you can track your activity level and set higher goals as the weight comes off. Let's talk about how to prepare for your balloon removal. Orbera balloons must be removed after 6 months, and Spatz balloons after 8 months. Please note that this is not optional, as if you leave your balloon in longer than what it's approved for, there is a risk of balloon rupture, which could cause a bowel obstruction and require emergency surgery. Proper preparation for your balloon removal is really important. We need to make sure there is no solid food in the stomach. If there is, when we start the procedure, we may have to abort, which will result in significant added cost. A medication called Reglan, or the generic, which is metoclopramide, will be prescribed prior to your removal. Take this according to the directions on the label, beginning 48 hours prior to your procedure. If you don't have this prescription within a week prior to your removal, please text or email us at the information we previously provided. We also require that you avoid solid foods completely for at least 48 hours prior to your removal, so stay on a clear or full liquid diet. And like always, nothing to eat or drink after midnight the night before your procedure. You will either be under heavy sedation or general anesthesia for the removal. After your balloon is removed, continue the healthy habits that you've learned over the last 6 to 8 months. Keep your high-protein, low-carb diet going along with regular cardio. We also can discuss medication options such as Adipex or injectable GLP-1 receptor agonists like Wegovy. These medications can help bring your hunger down and augment your long-term success. Thanks for your attention. If you have any questions about this info, please contact us using the information on this slide. Good luck with your procedure, and we'll see you soon.